Unlocking the power of CPT code is the key to streamlining medical billing and ensuring proper reimbursement. Join us as we explore the importance of this knowledge. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will explore the radiological, anesthesia and deployment and obstructive procedure course. Without further delay, let's get started. Our next topic of CPT anesthesia is radiological procedure. Radiological procedures refer to medical imaging technique used to visualize the internal structure of the body for a diagnostic or therapeutic purpose. Utilizes various imaging modalities to create detailed images of tissue, organs, bones, or other structures. First code is 01916. Anesthesia for diagnostic arteriography or venography. Diagnostic test is a test which help to figure out what disease or condition a person has based on their signs and symptoms. Graphy means to record or take a picture. Next code is 01920. Anesthesia for cardiac catheterization including coronary angiography and ventriculography, not to include swan gauze catheter. Cardiac catheterization is a medical procedure used to diagnose and treat heart conditions. Coronary angiography is a procedure performed to visualize the coronary arteries, which are the blood vessels that supplies blood to the heart. Cardiac ventriculography is a medical imaging test used to determine a person's heart function in the right or left ventricle. The provider performs anesthesia services for a patient undergoing a procedure performed to visualize the coronary arteries and medical imaging test used to determine a person's heart function in the right or left ventricle, which does not include swan gauze catheterization, which is the process of passing a thin tube catheter into the right side of the heart and the arteries leading to the lungs. Next code is 01922. Anesthesia for non-invasive imaging or radiation therapy. Not invasive treatment means that a procedure does not require the doctor to break skin. Not invasive imaging or radiation therapy is a set of medical techniques that enable healthcare provider to visualize internal structure, organs, or function without the need for surgery or invasive procedures. Next code is 01924. Anesthesia for therapeutic interventional radiological procedure involving the arterial system not otherwise specified. Therapeutic interventional radiological procedures. These procedures of arterial system are used to diagnose and treat arterial condition using minimally invasive techniques typically guided by imaging techniques. Next code is 01925 carotid or coronary artery. Same procedure is done in 09124 but on carotid and coronary artery. Next code is 01926 intracranial, intracardiac, or aortic. The provider performs anesthesia services for a patient undergoing therapeutic interventional radiological procedure involving the arteries that are intracranial, situated within the skull, intracardiac, within the heart, or aorta, which is the main artery that take blood from the heart to distribute to the rest of the body. Next code is 01930. Anesthesia for therapeutic interventional radiological procedure involving the venous or lymphatic system, not to include access to central circulation, not otherwise specified. Next code is 01931 intrahepatic or portal circulation. For example, transvenous intrahepatic portosystematic shunt or TIPS. It means the provider performs anesthesia service for a patient undergoing therapeutic interventional radiological procedure on intrahepatic or portal system, which is the blood circulation within the liver. Next code is 01932, intrathoracic or jugular. The provider performs anesthesia services for a patient undergoing therapeutic interventional radiological procedure involving the jugular vein, which is the major vein bringing blood back from the brain, or intrathoracic veins, which are blood vessels draining into the heart from within the chest. Next code is 01937. Anesthesia for percutaneous image guided injection, drainage, or aspiration procedure on the spine or spinal cord, cervical, or thoracic. Next code is 01938. Same procedure as in 01937 but on lumbar and sacral region. Next code is 01939. Anesthesia for percutaneous image guided destruction procedure by neurolytic agent on the spine or spinal cord, cervical or thoracic. A neurolytic agent is used to destroy nerve tissue, typically to reduce pain or to block nerve signals. The provider performs anesthesia services for a patient undergoing percutaneous image guided destruction using a neurolytic agent of the cervical or thoracic spine or spinal cord region. Next code is 01940. Lumbar or sacral. Same procedure is done in 01939 but on lumbar and sacral region. Next code is 01941. Anesthesia for percutaneous image guided neuromodulation or intervertebral procedure, for example, kyphoplasty or vertebroplasty on the spine or spinal cord, cervical or thoracic. Kyphoplasty or vertebroplasty are used to treat the fracture in the bones of the spine, and neuromodulation procedures are used for altering nerve activity through stimulation. Anesthesia service is provided for a patient undergoing percutaneous image guided procedure for altering nerve activity through stimulation or intervertebral procedure like kyphoplasty or vertebroplasty. The anatomic area for the procedure is the cervical or thoracic spine or spinal cord. Next code is 01942, lumbar or sacral. Same procedure, but the anatomical site is lumbar or sacral. Burn, excision or debridement. The next topic of CPT anesthesia. Excision means removal. Debridement means medical removal of dead, damaged, or infected tissue to improve the healing potential of the remaining healthy tissue. First code is 01951. Anesthesia for second and third degree burn, excision, or debridement with or without skin grafting any site for total body surface area treated during anesthesia and surgery less than 4% total body surface area. Second and third degree burn. Second degree burns involve the epidermis and part of the dermis. It appears red, bristled, or may be swollen or painful. Third degree burns destroy the epidermis and dermis. It may also damage the underlying bones, muscles, and tendons. The provider performs anesthesia services for a patient undergoing excision or debridement of less than 4% of the total body surface area for second and third degree burns. Next code is 01952. Between 4% and 9% of total body surface area. It means the provider performs anesthesia service for a patient undergoing excision or debridement of between 4% and 9% of total body surface area for the second and third degree burns. Next, add-on code is 01953. For each additional 9% total body surface area or part thereof, this separatory in addition to the code 5, the primary procedure. Use 01953 in conjunction with 01952. Obstetric. The next topic of CPT anesthesia. Obstetric is a field of study concentrated on pregnancy, childbirth, and postpartum period. First code is 01958. Anesthesia for external cephalic version procedure. External cephalic version procedure. It is used to turn a baby from a breech position to head down position. The provider performs anesthesia services to turn a baby from a breech position to a head down position. Next code is 01960, anesthesia for vaginal delivery only. Next code is 01961, anesthesia for cesarean delivery only. Next code is 01962, anesthesia for urgent hysterectomy following delivery. Hysterectomy is a surgery to remove the uterus. Next code is 01963, anesthesia for cesarean hysterectomy without any labor, analgesia, or anesthesia care. The provider performs anesthesia services for a patient undergoing cesarean hysterectomy, which is the removal of uterus during a cesarean section. The provider does not provide labor analgesia or anesthesia care. Next code is 01965, anesthesia for incomplete or missed abortion procedures. Next code is 01966, anesthesia for induced abortion procedures. Next code is 01967, neuroaxial labor analgesia or anesthesia for planned vaginal delivery. This includes any repeat subarachnoid needle placement and drug injection and or any necessary replacement of an epidural catheter during labor. Neuroaxial labor anesthesia is a method of pain relief used during childbirth, especially targeting the nerves in the neuraxis of the spine to block pain signals from reaching the brain. First add-on code is 01968. Anesthesia for cesarean delivery following neuroaxial labor analgesia or anesthesia. List separately in addition to code for primary procedure performed. Use 01968 in conjunction with 01967. Next add-on code is 01969. Anesthesia for cesarean hysterectomy following neuraxial labor analgesia or anesthesia. List separately in addition to code for the primary procedure performed. Use 01969 in conjunction with 01967. The next and last category of CPT anesthesia is of other procedures. First code is 01990, physiological support for harvesting of organs from brain dead patient. Next code is 01991, anesthesia for diagnostic or therapeutic nerve blocks and injection. When block or injection is performed by a different physician or other qualified healthcare professional other than the prone position. The prone position means laying face down. Next code is 01992. It is for the prone position. Next code is 01996, daily hospital management of epidural of subarachnoid continuous drug administration. Report code 01996 for daily hospital management of continuous epidural or subarachnoid drug administration performed after insertion of epidural or subarachnoid catheter. The provider performs anesthesia services for a patient undergoing epidural or subarachnoid continuous drug administration. This procedure is for the telemanagement by the provider of the patient receiving this service in the hospital. Next and last code of the CPT anesthesia is 01999, unlisted anesthesia procedures. Use this code to report procedures in the anesthesia section that do not have a specific code. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.